In February, we celebrated the International Day of Women and Girls in Science, and in March, it was International Women's Day. So we're going to focus on how science is building the knowledge and skills to support women with their health. So let's start the conversation. So it's lovely to meet you all, lovely to be here today. I'm just going to first of all just go to each of you and just ask what your role is and what you actually do. So Bill, let's start with you.
Oh, thanks. Well, like you, Roger, I'm a GP by background. And here in Reckitt, I work in the Global Medical Affairs team, and I've been quite involved in helping with this See My Pain campaign.
Fantastic. And Flora?
Actually, I have a similar background with Bill as well, but I'm a medical affairs scientist in the local market, so UK and Ireland. Like I said, basically everything related to science would be my responsibility, and I'm also involved in the See My Pain campaign as well.
Amazing. Big jobs. Okay. Lindsay, can you tell us what you do day to day?
Yes, Rhoda. So I'm the R&D category director for pain. So I'm responsible for product development. So for the pain brands across Reckitt's globally. And I partner with this team here on See My Pain.
Fantastic. Thank you. And Riz, finally, can you tell us what you do day to day?
Sure. So I'm the medical affairs manager for UK and Ireland. I work with Flora, Bill and Lindsay on the See My Pain campaign and the fight for See My Pain.
Amazing. Well, it's fantastic to have you all here. Thank you so much for joining today. Bill, I'm going to start off with you today, first of all. So can you just tell us what the three things are, if women are watching this series, what are those kind of three takeaways that you would want them to hear and sort of go away with and use and maybe in their day-to-day lives?
Certainly. Well, I suppose the main thing that we've recognised with our research recently is that there is definitely a gender pain gap. So women's pain isn't being taken as seriously as men's. And that's a real problem because women get more pain than men. We know that's true for chronic pain. And it's also true for everyday pains, pains like headaches, period pains, etc. And these common everyday pains, most of us get them. So they're very, very common, very frequent, but they're not trivial. They really interfere with people's lives. So we know, for example, that girls sometimes miss school because of period pain. Women miss work because of migraine. So it's really important that we recognise the importance of pain and that we support people in pain and that we improve pain conversations in society and between patients and healthcare professionals. And those are the things that we're hoping to do, and that's what I would like women to realise.
Fantastic messages. And like you say, pain is a sort of it's a thing you can't necessarily always see, and yet it has such a big impact potentially on your work, school, life, everything, relationships, mood. It just has a huge impact, doesn't it?
It is, you're right, and it's invisible to others, so it relies on people believing our self-reports about pain, and that's where bias can come in. Because what we're finding through our research is that people are a little bit less likely to believe a woman's account of pain. There's this stereotype that women might be over-dramatising pain. It's a stereotype, that's not an objective fact. But that's what we're trying to raise awareness around.
Amazing, fantastic work. Lindsay, let's come to you. So just tell us how the category R&D team has partnered with medical sciences more broadly on women in pain. What's been that kind of collaboration?
Yeah, it was a cross-functional team effort. So working predominantly with medical, but we had regulatory, medical marketing teams and clinical teams on the project as well. And it was a fantastic project to work on, Rhoda. The energy, the passion, the motivation from that team to work on See My Pain was huge. And I'll always remember a lady called Catherine Lloyd, who was head of the global marketing team for pain at the time, shared with us a video, and it was women talking to camera about when their pain had been dismissed. And she just said, this is the project that we're going to start working on. And she showed me it, and I watched it. I was just sat at my desk, and at the end of it, I was so emotional seeing these stories, and it was from women of all ages. And I just thought, we've got to work on this. And a little fact, one of my team members works on a different pain brand, and she saw the video as well and said, I need to work on this. So she was doing her own job as well as coming to work on this project with us. Highly motivated team, all pulling in the same direction. It was one of those teams where, you know, the sort of the saying, I can never remember the saying, but the sum of the parts is the team is the whole is bigger than the sum of its parts. That's that saying. You felt that.
Yeah, amazing.
And how we collaborated with the medical team. Bill brought in key opinion leaders, arranged advisory boards, brought in key opinion leaders from across the globe, experts in their field, psychologists in pain. That was new for me to work with psychologists in pain, neuroscientists, people who are experts in migraines, gynecologists, brought all these experts together. And that helped us create and learn new insights in this area, helped us inform the questions, didn't it, Bill, for that went into the pain index report. And it also gave us great insights outside of See My Pain. I was lucky enough to be invited to our board and hear those experts speak directly, and really informed how we moved See My Pain along, but also the entire innovation pipeline, that pain is not just the pill, it goes beyond that pill, and this whole multimodal approach to pain relief that Bill and the medical team have introduced us to in R&D category.
Amazing. 'Cause like you say, pain is that thing, is it, that goes across body systems,
Yes,
across organs, across all kinds of different specialities. So having all those different people there, just so important to understand the different types of pain, different natures of pain. And what would you say you've achieved as a collective? What would be your kind of top 2 or top 3 sort of achievements? I know there are probably many, but what would you pick out?
I think the achievements are that we've looked beyond the product for the first time as an R&D product development team, maybe not for the cross-functional team, but I think some of the achievements are looking at how compassion, and maybe it's more of an insight than an achievement, how compassion is really important about how we talk about pain relief. Is really important for me, and this came from one of our key opinion leaders and also from Bill, around how if you sit somebody down and talk to them about their pain, either a partner, either a parent, either a healthcare professional, and talk to them about their pain, talk to them about the product they're going to be taking, they get a greater outcome from that. And knowing these facts, knowing these insights, I think is a great achievement for us to roll across all our pain pipelines.
Fantastic. And how do your R&D teams kind of work to understand how to unlock consumer needs, what they need, with science that's sort of meaningful? How do you join those two things together? Because obviously you need to work together. So how do you join them?
Yes. So I work in product development. So my team will take a consumer needs, which has been validated in a concept, and turn that into either a product or into an innovation. And we'll also potentially take a medical insight and generate new either consumer or clinical data with our clinical team on a product. So everything we do is either rooted in a consumer need or a medical insight. If it's not rooted in that, we don't work on it. It has to have a solution that's beneficial to the end consumer. So that's what we do as predominantly as a team. Now, with See My Pain, in terms of the innovation cycle that we work through, we took it to a different level. So the full cross-functional team had applied bias training from an external company, arranged by our D&I team in Reckitt, and this applied bias training. External team came in and gave us case studies on other industries where they'd innovated with bias, and then what was the impact to the consumer when they launched that product. And we went through some of those case studies, and they were really interesting. But then what they got us to do is apply that lens to ourselves and made us look at our entire innovation cycle, from how we validate our concepts to how we write our protocols to test products, how we write our protocols to generate data on our products, how we look at our packaging. And we're saying, are we introducing bias as a team? So that was really interesting to look at it from a completely different lens for See My Pain as well, to get into that kind of thinking.
Yes, and very, like you say, very easy to sort of see what's going on with others or outside yourself, but then when people holds up a mirror and says, how about you? You're like, okay, this is interesting.
Indeed.
And then obviously then those kind of improvements and changes can be made, which is fantastic.
Yes.
What are some of the early insights that you've kind of uncovered on the topic of women and pain?
I think the So we had, when the project first kicked off, and we were talking about some of the insights, but then we went into some of the research. I think for me, the things that stood out were some of the facts. So you knew that adolescents suffer from period pain, but the numbers that came out of the research, that 30 to 40% of adolescents miss school because of period pain and missing education because of their period pain. And there's over-the-counter medications that can help with their pain relief. There's solutions out there, but yet they're still missing school. And period pain impacts sleep, it impacts your mental health, it's impacting their education, and there's solutions out there. And I think with See My Pain, some of the insights that came to me were there's still taboo subjects. Period pain is potentially one of those. And adolescents don't know where to go to get their key messages, their key information. What they look at different platforms. What are we doing? Where are we putting our research? How are we communicating? So for me, it was putting the numbers and validating the size of some of these issues were what surprised me as well from some of those insights.
Yeah. Anything that you weren't expecting? I know you mentioned obviously the size and the stats, but anything else that you weren't expecting to have come out of some of the work you've done?
I was talking to Bill about this the other day. The biggest surprise for me was there was a gender pain gap. And I've worked in product development, in pain relief, on and off, different roles, in totality about 12 years on and off, and I didn't know a gender pain gap existed. Now, Bill, I'm sure you'll have had an inkling from your clinical experience.
Yeah, Bill, let's just go to you. From obviously your clinical work and clinical experience, but were you sort of surprised by the fact that existed? And I suppose then the secondary question, how big it was or how significant an impact it had?
I wasn't fully surprised, Rara. I don't know what your experience is as a GP, but I remember even as a medical student, I remember, for example, seeing female patients in surgical wards and they had abdominal pain, and there would be a suspicion that this might be psychological much more than for male patients who had abdominal pain. So I think I wasn't really surprised when I heard about it. But what maybe did surprise me is that we don't talk about it very much. It's not really been out in open conversation. And that's a problem, because until you bring something like this out into open conversation, it stays unconscious. It remains an unconscious bias. It's under the radar, and it's much more difficult to tackle when it's under the radar, when it's hidden. And that really, so it wasn't a surprise, but what did surprise me was that there is research out there. So we found research, we confirmed it's a problem, and then we started doing our own because there wasn't a lot of measurement of this. And Riz and Flora have done an amazing job with actually measuring the index report, the gender gap index report. So we've now got figures that can support this. And it definitely seemed like a gap that we needed to move into and start to communicate in. So yeah, not a surprise, but definitely a need.
And I suppose on that, what advice would you give people in terms of kind of tackling bias or having that kind of constructive conversation with their physician, their doctor or pharmacist, if they are in pain? What would be your advice on a sort of practical day-to-day basis about how to open up that conversation or tackle some of that bias that might be out there?
That's a really good question, because certainly when you're talking to a healthcare professional, it can be difficult sometimes to challenge, can't it? And yet, when you're sitting in a GP surgery, I think we're quite used to people occasionally quite kindly just stopping us in our tracks and just redirecting the conversation. And that's what I would recommend that a woman should do if she feels that her pain is being dismissed. We've actually developed a tool. So we've developed a tool called Pain Pass, and it just gives some very simple advice. And the first advice, the P in PASS, is just to pause the conversation, just to say, I hope you don't mind me saying, but I just feel that perhaps my symptoms are not quite I'm not quite getting it across to you, how this is impacting my life, and just trying to reframe that conversation. So I think most healthcare professionals would respond very positively to that.
Yeah.
So I think just taking a little bit of charge, recognizing this is a problem and saying, please, can we just look at this again. I think that could really help.
Yeah, that's great advice. A pause, kind of like in a conversation that's going on a flow or a direction you don't really want it to go down is helpful, isn't it, for everyone just to reset and to always bring it back to that person and say, I don't feel. Often when people hear about people's feelings or emotions or how they're feeling in that moment, that can sometimes help them just stop and rethink. So that's great advice. Thank you. Riz, I'm going to come to you. So just tell us about kind of how working with healthcare professionals, pharmacists, and tackling some of the common biases and pain experienced by women. What's that like? How are we kind of working with them to tackle that?
So it's been really interesting, actually. I think the first instance was when Bill kicked this all off with the steering committee. And like Lindsay touched on, that he recruited all of those key opinion leaders. So we did something similar in the UK where we ran our advisory board for UK specific. And Flora worked on this quite a lot as well, where we recruited consultants, GPs and pharmacists from different professions within the pain in category, and we learned a lot of what goes on in day to day. So like Bill said, there was an unconscious bias, which we've all sort of awoken to. And the fact that it was unconscious is where some of the stereotypes arise from. So we learned quite a lot, and we were able to get a lot of feedback in terms of the tools that we've created, like Bill touched on, the pain pass. And we were also able to learn from their experience in education, from when they went from university all the way up to their profession, where some of the unconscious bias was. So even in instances of like the anatomy or in textbooks, for example, a lot of the diagrams and for example, in first aid, the dummy that is used is all male.
Yes.
You wouldn't be able to, in real time, associate how different the female anatomy is in that instance. So that from that early stage, those are the things we learned, that there is from the early stage that kind of bias that we need to wake up to. And from that, we've made a pledge as a company to make commitments to ensure that we've partnered with charity and organizations to make this more of an awareness, and in our clinical trials as well, as a company, that we recruit more women to make sure that our medicines do work and have the results that we need. So a lot of those learnings we're still applying, we're still taking forward. We're creating modules for GPs and pharmacists to help with their education on this gender pain gap. So there was a lot of learnings and a lot of actions that we're taking, and it's not a short-term fight. This is a long-term fight. It's not an overnight sort of thing that we can rectify. As we've said, it's an ingrained bias, and it will take time, unfortunately, but this is part of a long-term fight.
Yeah, and so important to kind of recognise where those biases come from, like you said, early stages of medical school, how they creep in, and kind of work to sort of target those early on. That's amazing work. Flora, obviously you've been working on that with Riz. Just tell us about your insights and kind of what you encountered during that work and in that project.
Yeah, so like we said, we did like an advisory board last year, but apart from that, we're not just trying to do HCP, so healthcare professional education through modules. We're doing it through scientific conferences as well. So last year and this year, we've been submitting like abstracts to a lot of conferences, international conference. We presented it in the EFIC conference in Budapest last year as well. So trying to raise the awareness of this unconscious bias in the healthcare community. When we are at the conferences, like presenting the abstract post to the healthcare professionals, they're also able to share their own experience. Like, because in one of the women's professional health conference that we attended last month, actually in London, so one of the GP actually shared her own personal experience that herself is actually facing this unconscious bias. So she had this like serious abdominal pain. So she went to her GP, and they were trying to say, oh, maybe it's something because of your hormones, like because you're having like a different mechanism in your body when compared to men. And so she didn't got like a proper diagnosis at the very beginning, but afterwards it was actually endometriosis. So it took her like a long time to get a proper diagnosis as well. So through these conversations, we're not just able to understand what is actually happening in a clinical practice, but we're able to see that this problem is not just in like a society, like general population, experiencing it. Even healthcare professionals themselves are experiencing it as well.
Yes,
So,
that's
yeah.
fascinating, isn't it? In terms of how it impacts even the people who kind of have that knowledge and that medical knowledge,
Yes.
and some idea about the sort of how the system works as well, which is really powerful, isn't it?
Yeah.
Riz, I'm going to come back to you. So, can you just explain kind of what are the common types of pain that women experience? What did you find from the work that you did?
So from the literature, we could see that there was everyday pains such as headaches, migraines. Then you've got more of the chronic pains as well, such as fibromyalgia. You've got bladder pain, and then you've got obviously the women-specific pains such as endometriosis. But like Bill touched on at the start, it could go from everyday pains that are not just women-specific, but they experience that pain differently due to the genetic makeup. So the genotypes and the phenotypes can be seen differently, and then neuro pathways can be completely different to men. So it's not just the women-specific pains where they can experience that at a completely different scale. It's also the everyday pains that can be completely different experience to men as well.
That's incredible, isn't it? And I mean, pain is, you say I'm in pain, but pain is so complex. It's such a complex thing to understand, but also to describe. And I think that's why it's great to have some tools to support people to be able to kind of translate, what they're experiencing into words that they can use to kind of hopefully get them the support they need.
That's exactly it.
Bill, I'm going to come back to you. So from a scientific kind of perspective, can you summarise some of the research that you've undertaken in this area, and how does it help to sort of tackle some of the challenges that we've spoken about?
Certainly. There are, I guess, two really big strands of research that we've been looking at. So one of them is around education for clinicians. So we've done some research with Imperial College in London, and it's looking at senior medical students, so medical students in the last year or two of their education. And it was qualitative research where we've basically asked them, what do you understand about the gender pain gap? What are your perspectives on it? And nearly all of them recognise it as a problem. So it comes back to what I said earlier, that I think intuitively in clinical practice we know it happens. So nearly all of them recognised it. But equally, they pretty much all said they've had no training on it. So we're not providing teaching on gender bias in general, and definitely not in pain. And they actually wanted teaching. The students were saying, we would like formal teaching on this, but right now we're having to teach ourselves. So they are interested in the topic. And what they're saying is that pain teaching very much focuses on things like the pain ladder and pharmacological approaches to pain. But there's a lot less of the psychological and society factors, which are really important in pain because pain is complex. So that's the first strand. We're looking now towards seeing if we can influence medical training and the curriculum by getting more formal teaching in and encouraging reflection in this area. And then the other strand of research is really just around understanding the insights a little better. So Lindsay mentioned earlier about period pain as being a really significant issue, and the insights that we've gathered on that so far are basically saying that this is something that affects girls' education. It affects 70% of women under the age of 25, and yet there are lots of approaches in society which present barriers to effectively treating it. So there are some attitudes along the lines of, well, it's physiological, so tolerate it rather than treat it, and that doesn't make sense. That's not compassionate. So that's one of the things that we want to understand a little better. And then there are lots of other factors around period pain. For example, difficulties with the situation in schools and how toilets are not as private as they could be, and how we could be improving education, because at the moment we think girls are getting education from social media, from platforms like TikTok, and there actually isn't really good sources of education out there that are trusted and that are providing good information. And without that, you can start to worry about what's causing your pain, and is this actually something very serious and not just a simple kind of period pain, although that's not a good way of phrasing it because we know it has impact. So we're going to work with Wellbeing of Women, which is a major women's charity in the UK. It funds lots of research. And that's the area that we are working on, trying to understand better about these kind of common female-specific pains, which are not being properly addressed at the moment.
Fantastic. And I mean, the stats, going back to the stats, I mean, 1 in 2 women feel that their pain is ignored or dismissed because of their gender, which is extraordinary, isn't it? I mean, so what are some of the challenges, taboos, misconceptions that we've learnt about women, and why do you think there is this sort of pain bias when it comes to gender?
That is such a good question, Rod. This is at the centre of it all. And we've looked really extensively at the research, and as Lindsay, Riz and Flora have said, we've talked to lots of experts now. And if I were to summarise it in the most simple way, I would say there's a stereotype in society that sees women as being emotional when they have pain, and yet men are seen as being brave and stoical. Again, that's a stereotype. I'm almost nervous to say that because when you start talking about stereotypes, you sometimes worry that you might be judged in believing in the stereotypes and acting on them. But essentially, we've all been socialized into thinking this way. It's a very, very strong unconscious bias. And we have to be humble around unconscious bias because all of us can be subject to unconscious bias. There was a really interesting case study in a big company some years ago where they realised that lots of women were not getting the promotions they should get. They were not in the senior positions, and they deliberately made changes in that company to promote women into senior positions. And when they'd achieved that, they thought it was job done. But then a few years later, they realised the same problem was coming back because the women that had been promoted were actually promoting men underneath them into higher positions because all of us can be subject to this unconscious bias. So we have to recognise the power of it. We mustn't judge people for believing that women might be emotional in the face of pain because it's an unconscious bias, but we need to sort of raise awareness around it, and we need to say to people, you may have this bias, healthcare practitioners as well, you may have this bias, but be aware of it, be aware of this stereotype, because if you're aware of it, you're less likely to act on it. And that's when it really matters, when you act on the bias. So that's why we want to bring it into open conversation. And that's really the whole point of See My Pain, to bring this into open conversation and then to look at ways that we can close this gap that you've just talked about.
And it's so important, isn't it, with bias, unconscious bias, any kind of bias, really, to be open to that, to be constantly checking in with yourself around that, to be asking the questions, to be open to someone actually pointing it out and not get defensive about it, because we're all kind of on that journey, aren't we? And like you said, at one point we may not have that kind of bias. In 3 years' time we may do. So it's a kind of constant thing to be checking in for all of us, I suppose, and to support each other in the society as well, to actually kind of notice that and talk about it. Now, we know that women are in pain often more severely than men. So can you share a little bit with us around the prevalence of that pain, and why is there a higher prevalence in the types of pain experienced by men versus women? What have you found out about around that?
That's a really good question. So there's lots and lots of research around the world that shows that, for example, with chronic pain, so that's pain that's going on for more than 3 months. It can be off and on, but for that kind of pain, women do get more pain than men. So they have more chronic pain. So these are conditions like fibromyalgia, irritable bowel syndrome. These are conditions which are more common in women. But also, and I think this is less well known, for just simple everyday pains that all of us get. A few years ago, we conducted some research across Europe. And what we found is that on average, women get 1.6 pain occasions per month. So these are normal pains, headaches, musculoskeletal pains, back pains, those sort of pains. Men get 1.2 pain occasions per month, so a little less than women. And that doesn't include the female-specific pains. So the female-specific pains like period pain, endometriosis, we know these are really common conditions, but men don't get very many male-specific pains. There are some conditions like prostatitis, but it's quite rare, whereas female pain is much more common. We don't fully know why that should be. There are different theories in the research, and hormones seem to play a part. So, for example, if you look at migraine, which is a very common pain condition, about 1 in 10 people get it. And yesterday in Parliament, there was a big debate about migraine. So it's becoming better known, which is a good thing. Until puberty, girls and boys get the same prevalence of migraine. But from puberty onwards, when hormones start, you see the prevalence widening. And eventually, women get migraine 3 times more often than men. But that only happens after puberty. So we think hormones are important. And think about the menopause. There are pains around the menopause, like pains in joints and muscles, that women commonly get, which again are hormone related.
Really fascinating, and again, just really kind of drives home that message of just making sure we're personalising care to individuals rather than just sort of templating it and putting a rubber stamp on everybody. So it's been a fascinating conversation. Thank you all so much. Just before we go, I'd love just to come to each of you just for maybe like one quick sort of message that you'd like to give people who are watching this, maybe around pain or around what you're doing or the work you're doing. Maybe Riz, will come to you first.
Yeah, sure. So I think it's just important to understand that this is a movement and a fight for the awareness of the gender pain gap, and obviously it's not an overnight success. This is a long time, because this bias has been ingrained in society for a long time, and it's not just directed towards healthcare professionals, it's society as a whole. So it's also friends, family that can be involved in this dismissive nature towards women. And I also think that the more we drill into ourselves that we can be dismissive without even thinking, and we pause those conversations ourselves, not so much coming from the women, but just check yourself and see, am I taking in this woman's experience? Am I listening to this woman? Am I empathizing? All those small steps. And I think once that's become a routine, I think that's one of the first steps we can take. Of course, there's a lot more to do around that, a lot more research, a lot more extensive models that we need to put into society and healthcare as a whole. But I think these are one of the first steps. And
what's that kind of one take-home message you'd like people watching to sort of go away with and maybe act on as well?
So I think the key takeout, which I'd start with myself and I think everyone else can take, is that it's a long-term fight and not an overnight sort of success. I think everyone needs to take the baby steps and really have the awareness of the ingrained bias that we have, and that's the first step. And from there, we can take the baby steps of trying to take this fight on with empathizing with the women, pausing those conversations to really check yourself and see, am I doing the right thing? Is everything being taken into account? Because this isn't just a gender pain gap awareness for healthcare professionals specifically. This is for all of society as well. So friends, family, teachers, anywhere where females can be affected.
And Lindsay, what about you? What would be your kind of one take home from this? I know there's lots of them, but what would be your focus?
I think for me, my focus would be, when I was mentioning around the gender pain gap was a surprise for me, I didn't have to go far to validate it by talking to friends, by talking to colleagues. I could quickly find somebody who had had their pain dismissed, and I would say, be confident, go back, you know yourself, you know your own body, go back and have those conversations, and be open about those conversations. I think the other key thing I want to take out of it and people to be aware of, it's not a finger pointing exercise either, and it's around the right education and being aware of it. And we know that healthcare professionals have been very open to receiving the education as well. So all of us working together. But the key thing for me is have those conversations, you know your own body, keep persevering until you get the treatment or the diagnosis or the conversations that you need.
Bill, you've obviously done a lot of work in this area, and some of the things you've mentioned today have been fascinating. What would be your kind of one message to people watching, and what would you like to see improve with regard to this area?
Well, what I'd really like to see improve, for me, this has been a really interesting experience because I worked in the NHS and in medical education for 30 years before I came here. I've never had a commercial role until I came to Reckitt 3 years ago, and this has been the biggest thing I've worked on. And I think it shows what industry can do, because industry has a really big reach. So in medicine, we can write papers, but only a few people read these peer-reviewed papers. If you really want to reach society, then industry works with communication companies. It can make a big difference. So that, for me, has been a real revelation. And we did a meeting a couple of weeks ago in London at Olympia, and Riz was there, and Flora was there. And we had lots of GPs and women's health experts in the audience. And we shared insights from this campaign. We had some expert speakers. And to a woman and man in the audience, you could really feel that people appreciated hearing about the gender pain gap. And we had comments from GPs along the lines of how refreshing it is to come to an industry meeting and not be sold a tablet, but actually to be educated about something that makes a real difference in clinical practice. So it's been such a privilege to work on this campaign and to work with people like Lindsay and R&D. It's such an amazing team, this pain team. So that's what I would like people to take away, that companies like Reckitt and industry in general in self-care is capable of making a difference to society. And we should be doing that. We should be giving back to society. And that's what the fight is all about. So that's been a revelation for me.
I love that. Yeah. And I can, as I'm talking to you all today, I can feel the passion about, the topic you're working on and why you want to do that. And I think that's probably because all of us have either experienced pain, know someone who's in pain, or perhaps experienced someone who's been dismissed in pain. So we can all have that kind of human element. And that's great. So, Flora, you obviously worked very hard on the report that we talked about. Just tell us what you were most satisfied about in terms of that report, or the outcomes of that report.
Yeah, so, well, first I would say I'm really proud that I'm working on this campaign. So it's not just like myself working on it. Riz, Bill are also working behind this whole campaign as well. So last year was like the second year of us running a campaign. And what we did is that we have like a annual survey, surveying like over 5,000 of patients who are actually suffering from pain. And we can actually see the gender pain gap that we've been talking about has actually widened from 7% to 11% last year. So we can see that actually more women in the society are actually feeling that they're being dismissed because of their pain. And from the results, we can also see that most of the patients are actually willing to go see the doctor to talk about their pain that they're suffering, but because they feel like they may be dismissed, and so makes them hesitated to not go to the doctor. So I feel like if patients are more confident while the industry record of raising awareness in the whole healthcare community, we're not just trying to tell the healthcare professionals to pay more attention to their patients, but we're also empowering the patients to speak up for themselves as well. So it's like a two-way communication that will definitely help with the situation, I guess.
I love that, tackling it from both angles, because like you say, any conversation is hopefully or should be two-way, so trying to kind of support both parties with that. That's fantastic. Well, thank you ever so much, all of you, for joining me today. It's been fascinating. I've loved it. I've learned a lot, so thank you ever so much for being here.
Thank you.
Thank you.